Let's go to the next presenter, that is on comparison of anterior chamber iris fixated IOL and microceratum assisted LASIK surgery outcome in Mongolian adults. The presenter is Narangarav GUNCHIN. Sorry. These are two different, wider things too. But your topic, we'll see the topic, don't worry. From Mongolia, topic can change. Coming such a long distance.
Yeah. Hello, everyone.
Yeah.
First off, thank you for inviting me in this conference.
The topic is different
Yeah.
than what is printed here.
My name is Narangarav from Mongolia, Solongai Hospital. This study was conducted under supervision of Mongolian National University of Medical Science between the 2022 and 24. Refractive error are common condition in the population and are of the 5 leading causes of preventable blindness according to World Health Organization. Presbyopia, a condition that affects the quality of life and reduce work capacity and productivity. We set 3 main objectives that can be seen on site. Firstly, we evaluated refractive errors who agreed to undergo cataract surgery. Then we estimated visual outcomes of patients who underwent different cataract surgeries. Lastly, the visual outcomes of monofocal and trifocal IOS. Sample size was calculated using formula above. This study was conducted using a retrospective cohort. Study design is we collected data from hospital database. At our hospital, cataract surgery was done, total 3,500 people for the 4 years. Of these patients who were included in our study went toward IOL calculation and appropriate lens IOS were selected. And those patients we follow up the first of 1 day, 1 week, 2 weeks, and 1 month. You can see the inclusion and exclusion criteria in this slide. We see it in our study. Then mean age results. Then mean age was 24, and with myopia 41, 7.87, and hyperopia is 51 in age group. The mean difference in age group was statistically significant, and a sex ratio of 2:1. Of all patients, 15.5 of them had low myopia, and 31% had moderate myopia, and high myopia was 63% of this. 69.06% had monofocal IOS, and 30% had trifocal IOS. The myopia group had twice as many monofocal IOS than trifocal IOS. No difference were observed between the groups in terms of refractive errors in type of surgery. And myopia group, the preoperative best correction visual acuity was 0.7, and the monofocal group, which improved the 0.5 on post-operative 1 day. And the post-operative trifocal IOS pre-op visual acuity was 0.3, which improved then 0.2 in post-operative 1 day. We use regression analysis to examine the above results. We examined whether the visual outcome after surgery differed the refractive errors types depending. And myopic group pre-op near vision in the monofocal group was 0.9, while in the trifocal group it was 0.4, indicating that the near vision in the monofocal group was weaker. In hyperopia, the pre-op near vision was 1 and the monofocal groups group and 0.5 in the trifocal group, indicating that the near vision was 2 times worse in the monofocal group. Now we're first off one where 1 month and monofocal groups improved the 0.5, while the trifocal group improved of the 152 patients with the refractive errors, 80% were myopic, of which high myopia was at 68, and hyperopia was 19% in percent. And myopia and hyperopia group visual acuity improved in short period of the time after trifocal IOS implantation. Thank you for attention.
Thank you so much presenting this series of cases where you have subjected the young patient to undergo cataract surgery. Your average age in the male for 34 and female 45. And we have so many other options to correct this refractive error. We could have used phakic IOLs and preserve the patient's accommodation for a longer time. Trifocals might give you immediate improvement vision, but in the long run we are not sure because your follow-up is just few months.
Yes.
If you see these patients 3 years, 5 years, 10 years, the entire scenario would change. And doing a clear lens extraction in high myopes is always challenging. You had almost 18% high myopic patient in your group, and these are challenging cases for future also. You didn't have any complications?
No, it's only exclusion and
No. You can have a surgical challenges because to do a clear lens extraction in young patient can be really challenging. And to implant lenses and see these patients, especially trifocal lenses, they can have so much of difficulty in day-to-day activities. Driving can be difficult in young patients.
No any complications.
The pupil size is bigger. In Mongolia, you have so much of brighter light, and they can be having a tough time also. But I think, if you have access to phakic IOLs, you should use these phakic IOLs for these patients rather than making them, pseudo-phakic. That's another option. Any question? One question I'll take. Okay, thank you so much.
Okay,
Welcome to India, and enjoy India for some.